Hi everyone, welcome to SF Live. I'm your host Rebecca Taft, and my guests tonight are Susan Phillip, who is from the Department of Public Health, and Nikole Trainor, who is a research assistant working on the Bravo study. And what is the Bravo study, you may ask? It is a study that focuses on women's reproductive health and ways to keep young women healthy, which is very important. So thank you ladies for being here.
Thank you.
Thank you.
So Susan, tell me, what do you do at the San Francisco City Clinic?
Yeah, so the San Francisco City Clinic is part of San Francisco's STD Prevention and Control Services, which again is part of our Department of Public Health. And our mission at STD Prevention and Control is really to try and maximize the sexual and reproductive health for all San Franciscans. So a big part of that is really trying to increase and improve young women's sexual health and reproductive health, because the groups that are most affected by STDs in San Francisco include young women, particularly young women of color. And so we're always trying to find new ways to reach out to those communities and to actually increase the knowledge and awareness of sexual health and of STDs and of the resources that are available in San Francisco for residents and for young women in order to stay healthy and in order to maximize their sexual health.
And is the City Clinic a place? Like, I have I don't live in the city, but is it a place? Do you have multiple locations? Do people make appointments? How does it work?
Yeah, so I think that's a really good thing to go into. We're really unusual for a major city in that we have a single STD clinic, and so that is City Clinic. We gave it kind of a cuter name so that people can talk
like the
about
STD
it.
Clinic of San Francisco.
Right.
Woohoo!
Yes, and we're trying to be the new sort of modern hip way of thinking about STD. So it's not that it's this dark, dank, sort of shameful place to go,
Right.
but it's a place that anyone can go, for sexual health and information. But particularly, our mission is always, again, to really serve the communities and the populations in San Francisco most at risk. So it is a place. It's physically located on 7th Street in the South of Market neighborhood between Folsom and Harrison.
Okay.
So people can come there. We are open 5 days a week. The best way to figure out when we're open and when to come is to look at our website, which is, I think, listed on the screen. But
sfcityclinic.org.
That's right. And the website itself is a really good resource for people sort of as a first stop. And we always say the internet is fabulous because you can sort of be anonymous and get a lot of information.
Oh, yeah. I always go on there and look up stuff that's wrong with me, and half the time it's all wrong stuff. But you like to know.
Yes.
You're like, what is this?
I think
Why
it's
am I coughing?
really important, especially with STDs. There's still a lot of stigma and a lot of worry about it, and it provides a nice way for people to get information. The one thing I would say is there are lots of bad information sources out there too, but we're a good source. CDC is also a good source, and we try to be very sex positive on our site in terms of recognizing that sex is a healthy part of life, and we're just trying to maximize the ways in which people can stay healthy while having an enjoyable and fulfilling sex life.
Oh, good. And so how can someone do that? How do women do that then?
Well, for young women,
what are some tips
I
or
think
hints or not hints, but I mean, what should young women be doing or not doing?
Well, I think one of the main things that young women should do is to recognize, particularly if they're younger than 25, that they should be having a chlamydia test done regularly. We recommend at least once a year if they're sexually active. And usually this goes hand in hand with a regular visit to get an annual pap smear. And it's important to talk to your provider and make sure that that's actually the test that you're getting, because it can be sometimes confusing when you're having an exam what all tests are actually being done and sent. And a good provider will sort of talk you through it and explain what tests you're having done so that you are aware and sort of more in control of your health. So I think that the best thing that young women can do is try to become a little more informed about their own sexuality and about their own ways and the tests that can be done to sort of improve their sexual health, to talk about it, and to also recognize that getting regular checkups is a good thing. It doesn't necessarily mean that they're diseased or there's anything wrong with them. And it's much worse. We worry a lot about young women walking around not knowing that they might have an STD. The most common ones are chlamydia by far, and gonorrhea is also a concern, because those infections, if they're left untreated, can lead to problems with having children down the line. It can cause infertility, it can cause abscesses or infections that can be serious within the abdomen, and we really want to prevent any of those really bad outcomes. So
it's better to just It's better to know than to not know.
That's right. And we call that screening. So people can very often have no symptoms, and that's something that people don't often realize about STDs. They can be asymptomatic, meaning that you don't feel bad at all, but it can still be there and causing damage. So we want to make sure that people get checked regularly. That's where the recommendation for the annual screening comes in.
Okay, and does this have to do with something with the Bravo study,
Yeah.
sort of STDs and what's happening with young women?
It does. So I'll just talk a little bit about what BV is in general, and then I'd like to sort of turn it over. Nikole is the expert on all of the details of the Bravo study. So
should wear a sign. I am an expert on
she
BV.
is. So bacterial vaginosis is another condition that sometimes women have, and it really is an abnormal distribution. We all have normal vaginal bacteria that are healthy and good, and they're called lactobacilli. And when people have bacterial vaginosis, it means sort of an overgrowth of bad or unhealthy bacteria and having less of the healthy bacteria there. And that can happen for many reasons. And it's not a traditional STD. It doesn't mean that your partner gave it to you or that you can give it to someone else, but it's been associated in some people with having sex. So it's a little bit more complicated than just, yes, it's an STD or no, it's not. What we know about bacterial vaginosis, it can cause symptoms such as itching or discharge or burning. And in those cases, we definitely think it should be treated because the patient is feeling uncomfortable.
Right.
But if someone is feeling absolutely fine and we just happen to find it, right now the standard is not to give people treatment. Asymptomatic bacterial vaginosis, where people feel completely fine, we don't usually treat it. Now, there's an interesting concept that's come up, and that's the basis of the study. What if these women with asymptomatic BV, if we treat them, will that decrease their chances of having chlamydia or gonorrhea when we check them 2 months, 4 months, 6 months down the line? And so it might be that treating this intermediate condition might decrease diseases that we know really have bad outcomes, namely chlamydia and gonorrhea. So that's the basis of the Bravo study.
Okay, so now I have two questions.
Yes.
So what if someone had sort of those symptoms? What's the difference between BV and sort of like just a plain yeast infection?
That's a good question. They are both types of vaginitis or inflammation of the vaginal tract. So you really wouldn't know unless you actually came to City Clinic or went to your provider and got checked. So that's a good take-home message apart from the
do you have
study.
to like specifically ask them to like
No.
test you for
Once
something?
you tell them generally that you have burning or discharge, what they'll do is called a wet mount, where they'll just have you give a small specimen, either if they're doing an exam or you can get it yourself, and they'll look at it under the microscope. And it's a painless procedure.
And has BV then been linked to STDs?
Yes.
Down the road?
Yes, it has been linked. So there is an association between people who have more BV and people that have more chlamydia and gonorrhea. And, we mentioned earlier that particularly communities of color and African American adolescents, they have high rates of BV. And they also have high rates of chlamydia and gonorrhea. So we don't know if there's a causal effect.
Okay.
But this is part of what the study is trying to find out. If we treat people for the BV, does that improve their outcomes in terms of not having as much chlamydia and gonorrhea? And so the Bravo study, as Nikole is going to talk about, is it's a very large national study involving 5 cities. And San Francisco, our public health site, is the only one in California. So I guess I can let
People
Nikole.
can come from all around California.
Well, we really like San Francisco residents, but
good.
to be part of the study, just because they have to physically come into the clinic.
Yeah.
But
So let me first ask you a little bit about your background and how you became involved in the study.
Okay, actually, I'm an MPH student at San Jose State University. I was connected actually with the San Francisco Public Health Department. I volunteered for them during some health fairs, and they did screening for chlamydia, gonorrhea, also HIV testing. On the side, I actually am a phlebotomist, so that's how I connected with them.
What is that?
Actually,
I'm a phlebotomist. I don't know what that is.
I just raw blooded. That's just a complex word for
Well
it.
then.
So that's how I got connected with the San Francisco Public Health Department. I volunteered my skills in that area, and this opportunity actually came up, and I was connected with Dr. Phillips, and we went from there. And
So you're a research assistant or
Research
associate?
assistant.
Okay.
she holds the study together. The research
good.
assistant is not a big enough term. So
Oh, good.
yeah,
You're the queen of the research.
that's right.
And that's what's so unique about our study is that there's only 3 people on our staff. So our participants participants actually get to know us personally and so forth and have a close connection. We get to build relationships with them as well.
So tell me a little bit about what the Bravo study, what do you do?
Okay.
Who is
so
it
actually,
for? What's happening?
So our primary population are women between the ages of 18 to 25.
Okay.
Of course, just like Dr. Susan said, we want women of color because they have the highest rates of STDs and so forth. And so if you want to participate in the study, the first step that you need to do is usually we call to make an appointment, but I'm very open with my schedule. We're very flexible with the screening Mondays through Fridays. We just like to know when our participants come in so we can give them expedite the service as fast as possible.